In this video, we will discuss all of the information regarding to the genetic testing of schizophrenia. Schizophrenia is a mental disease that causes the victim to be unable to distinguish between what is real and what is not. Patients have subtle differences in brain structures, such as the frontal lobes, hippocampus, and temporal lobes. A recent study has found that these structural differences in the brain may be caused by glial cell dysfunction. Glial cells are designed to help nerve cells build and support effective neurological communication systems. Dysfunction in these cells do not allow the signaling functions of neurons, leading to a desynchronized and uncoordinated nervous system. About 0.3 to 0.7% of people are affected by schizophrenia in their lifetimes. According to Schizophrenia, there are about 20,000 causal SNPs that impact one's risk for developing schizophrenia. Many SNPs have a small impact on disease risk, such as the genetic variations in the genes CANAC and DAOA. However, it is not known how much these variations contribute to developing schizophrenia compared to environmental factors. Environmental factors throughout your life can influence your risk of developing schizophrenia, like season of birth, child abuse, drug abuse, and urbanization. Our SNP chip test screens for approximately 5,000 causal schizophrenia SNPs. We test for three major genes: LINCO1360, LOC1053788801, and CACNA1C, but the main predictor SNP that is tested for is RS10066737, which is found in the CACNA1C gene. This gene is associated with the upkeep of calcium channels found in neurons in the brain. These channels carry signals between neurons, which in turn control most all other cells in the body, especially neurons in the frontal lobes and hippocampus. These areas control perception, but can become impaired by alterations to the function of the calcium channels caused by SNPs in the gene, which leads to hallucinations and paranoia, the most common symptoms of schizophrenia. By screening for genetic abnormalities, individuals have the ability to seek treatment options for the prevention of the disease and be monitored if needed, and researchers are able to gain new information about what genes and abnormalities are associated with a specific disease such as schizophrenia. There are many genetic variations that are associated with schizophrenia, and if an individual's genes were to contain a large amount of these variations, they would have an increased risk for developing the disease. Regardless of the results, individuals that take the genetic test would be contributing to the research of schizophrenia and the work towards early treatment. While a positive genetic test does not necessarily mean that you are going to develop a specific disorder, it does reveal if an individual is at a higher risk for the disease. That is the case with schizophrenia. There are many genes that are correlated with schizophrenia and may contribute in a sense, but there's no one specific gene or SNP that causes schizophrenia and could be identified to an individual as if they're going to develop the disease. RS10066737, however, is an extremely relevant SNP associated with schizophrenia that our SNP chip test is able to test for, and it would be beneficial to know the results. While there are many benefits to taking this genetic test, there are limitations present as well. Many variations that impact the risk of schizophrenia are still unknown. There are about 20,000 causal SNPs for schizophrenia, which is an extremely high number for genetic variations associated with a disease. This makes it difficult to get exact information when genetic testing and the SNPs that are in common in schizophrenia patients do not exactly have high risk associated with them. It is the combination and number of SNPs that is significant. Also, a negative test does not mean that an individual has no chance of developing schizophrenia, and vice versa. A positive test does not mean that an individual will 100% have schizophrenia. There are always exceptions in each study. There are some things to keep in mind when one decides to have a genetic test conducted. If the test returns a positive result for a genetic mutation that may have negative effects, the individual affected may develop elevated levels of stress, possibly to the point of developing a stress-related illness. Individuals may also possibly be denied health insurance or have their rates elevated should their provider learn this information. Also, individuals who disclose this information to possible employers may be disqualified from the position applied for. Some may be driven to undergo unnecessary and expensive medical procedures to lower their risk of developing an illness. It may actually be best for individuals to go untested unless a parent or grandparent has been clinically diagnosed as having schizophrenia, as the chance of developing the disorder is typically only significantly elevated if it is either known that a family member has the illness or a major psychosis has occurred in the individual interested in the test. Privacy concerns are also a major point of contention. Many individuals are of the opinion that the government may attempt to access this information and use it for nefarious purposes.